Welcome, everybody. I'll just give it a few seconds to let people start coming into the room before we start. Okay, welcome, everybody. Good morning, good afternoon, good evening to all of you who are joining us. I'm very happy to welcome you to this webinar organized by the CFB Working Group on linking humanitarian assistance and social protection. My name is Kate O'Donnell and I'm the coordinator of this working group. And for those of you who don't know too much about our group, it's co-led by UNICEF, SCDO, IFRC, and it's a multi-agency platform that brings together humanitarian and social protection practitioners on a common platform to engage in dialogue and strengthen coordination and really foster learning and knowledge generation with the ultimate view to strengthening the humanitarian development nexus. So I'm just going to take you through quickly some housekeeping so we can move to the next slide. Just so the webinar can run smoothly. So this webinar will be held in French, but we have simultaneous translation available. So as you see here on the screen, if you just look at your control bar, you can click on interpretation and select the language that you want to hear the webinar through. And also we really want to foster as much engagement with the audience as possible. And we really want to hear your questions and ideas. So please put your questions, think of your questions and put your questions in the Q&A box, please. And yeah, we would really love to hear from you and really get some engagement going. And if you could also put the name of your organization and your name as well when you put a question, that would be very helpful. Also, if you have any reactions or ideas to share on social media, you can use this Twitter handle down here. And again, we would really like to foster some debate on this topic. Yeah, and as I mentioned before, knowledge sharing and learning is really a core mandate of this group. And what we really want to do is explore best practices and the issues related to linking humanitarian assistance and social protection. And therefore today we really wanted to focus on the potential of national response plans to improve coherence and coordination between humanitarian actions and social protection policies. I suppose with the ultimate idea of how can we meet the needs of populations who are experiencing shocks, either through humanitarian resources or development or social protection resources. And this topic is sort of core to this working group. And what we also want to do is really talk about the details, the lessons learned, examine the experiences of countries. So this is why we chose two cases to look at today. So we're going to look at Madagascar and we're going to look at Niger, who both have extensive experience in implementing and developing these plans, but also bringing together diverse sets of actors to try to tackle these common challenges. So we really want to hear from their experience and hear what has gone well, what has not gone well, and what can we kind of learn from that. And to do this, we have a diverse range of speakers from government, humanitarian, experts, and donors. And we're really delighted to have Sigrid Kulke, one of our working group members, to moderate this discussion. And she is also DG ECHO's thematic expert on social safety nets and cash for Africa, and is based in Nairobi and is very passionate about this topic. And therefore, we really thank you for taking on this role. And without further ado, I'll hand over to you, Sigrid. Thank you.
Thank you very much, Kate. I think there's something now on terms of in terms of translation. Okay, now we're on the right slide. So I would like to welcome very much.
Désolé, I will switch. So we are going to speak both language today. So I would like to welcome the team that is joining us since Madagascar from the government. We have Mr. Ratovo Mamonji. Please, sorry, because I'm not still able to pronounce your name well. He's from the Ministry of Social Protection and Director of Social Security at the Ministry of Population, Social Protection and Protection of Women in Madagascar. And we also have Colonel Fali, who is joining us since nation, the National Bureau of Risk Management and Damages. So they have a setup to manage crisis and disaster. This is from the government side. And for Niger, we have participants who are a different type of stakeholders. We have Madu Diakite. She's a technical advisor and she's also an expert for food and security nets and with a diverse experience in the national setup of food and security in Niger. And we also have an humanitarian officer from the international sector is Amadou Azuma, my colleague who is coming from the office. He's a program officer from Niger. So thank you all of you for joining us. So we will move directly to introductions. Now we are going to give the floor to the team of Madagascar, and after we are going to and we'll have to discuss with the panelists before giving the floor to the participants. So if you have questions during the presentation, please don't hesitate to send your questions and comment in the question and answer box or the chat box, and we are going to try to look at the questions. So concerning the introduction, I just want to say that today we are in a context which are somehow related, even if they are from opposite sides of Africa. They are recurring crisis context in terms of drought. For years now, we've been population have faced with food crisis, precisely in Madagascar, which is in South, and Niger, which is in the Sahelian area. And this is part of the framework of these various countries. But this crisis, which are slowly growing up, to this crisis are associated rapid crises such as inundation, epidemics, and floods like in Madagascar. And for years, for some time, so we can get the speaker clearly. So those crises are really, really important, especially in Niger and other countries. Sorry, they are no more. In television information news, we can see that that is both on the humanitarian side and for political setups and sectors which affects directly households, and we are going to discuss about it, whether it is in terms of money or food distribution at the humanitarian and also resource transfers, which is quite insufficient. What I did not mention is that in this recurrent crisis situation, there are setups at the government level which for years have tried to solve these issues in a systemic way. And these are government with the support of donors and technical assistants who have put in place measures to help these countries both at the social and seasoned level to respond to settle points, and they have also dealt with routine transfer. We talked of social transfers, more than what we usually call social transfer managed by the Ministry of Social Protection. These are supports which have been set up recently. And we also have the third level of assistance is the humanitarian assistance, because the needs are still to be met with the complexity of crisis and resources that are gradually rare or scarce. What I also find interesting in this context is that there are multiple actors, and that's the topic of our day. There are differences in terms of stakeholders from the humanitarian sector. There are also differences in terms of objectives and humanitarian principles. There are clear differences when it comes to principles and also interventions means, and all these stakeholders are organized in a coordination architecture which at times overlap or are separated because there are various sectors concerned. There are transfer modality which are different, cash and food. There are various ministry involved. And anything concerning the humanitarian architecture. So today, these two setups show that how in these countries enormous efforts have been given to merge these stakeholders and interventions in order to have harmonized intervention based on the needs of the population. So without much ado, I will just mention that we are going to talk about three key questions to better understand how these actors are coordinating their activities. So we are firstly going to talk of the structure. We will have a little reminder of the recent crisis and the coordination means that have been set up, and also what were the lessons learned during the last crisis response. And we are also going to talk about the tools and also did I forget something? I think those are the 3 points. And we are also going to look at the governance question, because we know that all the actors have, and we are going to understand what have been done in countries to bring together these actors for a common objectives, which is to meet the needs during these urgent needs. So to finish is this nexus during this.
We solve the crisis in a time of need. Thank you very much. Now I shall give the floor to Madagascar. Okay, once again, good morning. Can you all hear me? We can hear you, but there is an echo, and we still can't see you. Can you please turn on your video camera? Okay, here I am. So we can begin the presentation so that I can talk about the Ministry of Social Protection. Allow me to present you this topic on the role of national response plans in improving the coherence and coordination of human assistance and social protection for Madagascar. We shall move on to the next slide. So first of all, Madagascar has implemented a national social protection strategy, which began in 2019 and which shall end next year, 2023. This strategy aims at reducing to 15% the extreme poverty rate in Madagascar. What is the situation, or how far have we gone regarding this plan, which is the national social protection plan in Madagascar? Here we have the National Strategy for Risk and Disaster Management, which is at the level of the management of risk and disaster in the region. A nation, and the aim is to create a nation which is resilient to shocks, protected from all damages in its social, cultural, economic, and environmental dimension for a sustainable development. This has been implemented since 2016. Also, we aim to scale up social transfers to provide capacity to meet basic needs and improve resilience. Also, we want to build a nation which is resilient to shocks. Next slide, please. What is social protection? This is an initiative, it's a strategic coordination initiative to support the government of Madagascar's efforts to establish a harmonized social protection system capable of responding to shocks through using the existing national social protection system to respond to a crisis situation. For example, the case of drought in southern Madagascar. It is also through the use of an implicit alignment between humanitarian and social protection actors. So we shall therefore work through humanitarian and actions in order to implement this social protection program. We are going to combine these two actions to solve this problem. Next slide, please. Next slide, please. In 2016, the program was launched. The Fiavota program was launched in 2016. We can't hear the speaker. In 2016, the Fair Voter program was launched in partnership with the World Bank, UNICEF, the World Food Program, and other partners in order to combine interventions together and to avoid overlapping actions. So there is a synergy of action, there's a harmonization of actions on the field to solve these problems. And these actions they were implemented right up to 2019. And in 2019, through these actions, we were able to achieve much at the level of to solve the health crisis which broke out in Madagascar. The next slide, please. Now let's talk about the response to Cash Working Group, which is a platform, an exchange platform during the drought crisis in Madagascar. This Cash Working Group was set up since 2020 in partnership with different technical and financial partners, with different international and national organizations, and other stakeholders. We can't hear the speaker. So regarding this, in December 2022, we had a crisis which was triggered in December 2022, and it was based on CPI results. We had more than 1 million people in phase 3, and in 2022 there was a gradual deterioration of the situation until it reached 1.6 million people in phase 3 of the CPI program in the first quarter of the year. So the number increased in 2022 to 1.6 million people. The objective of the Cash Working Group is to unite all partners and actors involved in humanitarian development to implement an efficient strategy in the fight against this crisis. In terms of as a response, currently we have about 12 members who are members of the Cash Working Group. Among them, we have UNICEF, the World Bank, the Red Cross, Malagas, the CRS, the SCI is the Food and Agriculture Organization, and other partners who are part of this Cash Working Group. For now, we have targeted 199,000 households. That is about 1 million people. Sorry, we have lost the speaker. An amount was adopted, which stands at 19.37 US dollars. That is 35% of the overall MAB. During the first half of the crisis, 35% of this was dedicated to the MAB. That was a minimum expenditure Also, 45% was dedicated to the food MEB. So the situation the current situation from last year, 2021, we can say that the percentage of these people, there is a reasonable percentage which is acceptable, that is between 80% and 100% of the population have adopted this strategy. Also, we can see that the government of Madagascar has adopted or has harmonized monetary transfers and has adopted policies which are adapted to the shocks on the field. In order to meet the needs or the fundamental needs of the population to enable them to face the challenges that they have and enable them to be more resilient and overcome or tackle the drought situation that they have. There was also an increase and an improvement in the situation. In September 2021, last year, we realized that the populations, the consumption of the population has reduced by 18%. That is after the first PDM result. Therefore, we can say that the objective on how to implement the system of social protection has been efficient, while bearing in mind that the objective was to reduce in an adaptive way the issues regarding social protection. Besides that, in terms of challenges or in terms of anticipation, we have seen that it is important to identify the triggering factors and to study we envisage or we plan to provide or to provide assistance in a hybrid manner to supply food to these households. The government is urging the active participation of every organization involved in the humanitarian development domain in order to strengthen their actions We have another case. In terms of institutional communication,
So we are not getting the speaker. I think we have an issue with the audio of the speaker. So what we are going to do is to give the floor now to BNGRC, and after we can add some elements. Is Colonel Fali ready to uh, complete what has been said so far? Yes. Can you get me clearly? Thank you. So please give me some minutes so that I can uh, display my presentation. Can you see my screen? Is it okay? Okay, to continue so that you should better get abreast of the context, which my colleague from the ministry just mentioned. As a reminder, Madagascar is among the most exposed country or the most vulnerable country to climate shocks, and some surveys, international scientific surveys have already showed this. As you could see one of the reports in 2021, as I showed before, there are also a certain number of surveys that have been carried out. Here in Madagascar, we've tried to draft, with the support of Bucha, the various major risks that Madagascar is exposed to, that is including floods, and also the part concerning the south of Madagascar, which is most vulnerable to drought, and also its consequences to food security and malnutrition. And there are also other aspects like insects which affect food security. As an example, Madagascar since 1960 had recorded 63 cyclonic seasons, 75 cyclones with diverse intensities, which has led to floods in local areas, and with 160, 146 in and major cyclones has been recording, that is from 1960 till date. So we took this vulnerability to catastrophes as a strength, and we worked and put in place text structures and resources. Regarding text, generally we have laws which gives the object of our presentation today. So it showcases the importance of intervention plans in to face risk, catastrophe risk, and more precisely intervention plans to manage crisis and face catastrophe. And we also adopted here in Madagascar since 2007 sector responsibility approach with sectorial coordination with leads and with management with the various departments of the government concerned and international partners which are working in the precise sector which is concerned. We have the health sector, which is led by the Ministry of Public Health and also co-managed by the WHO. We have the education sector, which is led by the Ministry of National Funds and also UNICEF and so forth. And this approach by sectorial responsibilities globally involves BNGRC, which is responsible of coordinating and which is actively supported by OCHA concerning the specificity of the topic at stake today. For you to understand that despite the fact that we are at risk and we are exposed to catastrophes and some surveys which attest it, we could at least organize ourselves and equipped ourselves to face these catastrophes whenever they will occur and reduce the risk. And concerning that, a certain number of operational tools was developed here in Madagascar. That is a preparation plan. A certain number of entities or organizations have specific preparation plans, which is more structural with drills, exercises, and others with other types of specific acquisition tools, which are part of the policy of capacity building. And when we talk of contingency plan, it is more of a plan, a short-term plan in which we've set up a certain number of elements which focus on sorry, we cannot get the speaker to put in place anticipation actions at alert levels and the setup of plans in order to alert and response plan. And with all these, it is a cycle that will be updated regularly. So we have an alert system which is based on a permanent monitoring system and a certain number of indicators. And for this, we try to disseminate and to teach a certain number of sectors to be more proactive when it comes to the various shocks we could have or the various information we could get at the various alert level. The example I'm going to take now is at the level of the drought that my colleague already mentioned. You will see that in 10 years, you could see how drought increased in Madagascar with a top point that you can see around December 2020 and January to February 2021. And with that, we drafted national response plans to face these situation and mobilize resources through the strategic and through short calls with our colleagues to our colleagues at the United Nations, international partners. So all this concerning the, so you can see that this doesn't hinder that for this year, for example, there are cyclones that could reach to 6 this year, like 2 particularly, of category 3. So for us, the objectives, because we have to save lives, and for the plan we have, this also helps us to better coordinate. Everything has been set up because it is a plan that has been coordinated at the sectorial level with we could have we could make sure that there should not be duplicates, and with the monitoring that we do later on, it reinforces these actions, and very quickly we try to anticipate, because early relief is not necessary. The emergency will not stay.
No
And
one wish to continue in this situation. As such, we are trying to ensure that all our activities integrate all the other stakeholders, be they development stakeholders or other actors who are working especially in the social protection domain, or those who are working in the Ministry of Social Protection. Some indicators have been provided for us to see and measure if we have been up to the task. The advocacy also, we are supposed to have a plan which is well defined, and it enabled us to launch appeals to see what we have, what we need, and etc. One of the things that we shouldn't forget is in the link between development. It is not something that we learn only here in Madagascar. That is why we are trying to ensure that we organize ourselves to integrate people who are in need and how to lead them to a certain level, where they shall assist in activities, etc. And quickly they shall be able to participate as actors in a development. Excuse me, Colonel, we are out of time. We have not listened to Niger. Do you wish to move to this sectorial aspect, how to show us how the coordination is being shown on the last slide? There is one part that you have that explains the role on coordination. As I earlier said, the ministry in charge of agriculture is linked to the BNGRC, such as the World Food Program, the FAO, in order to help us to have this synergy between actors and to be well coordinated regarding the needs that have been expressed on the field. We are also trying to have a better coordination of all these actors in identifying the strengths, etc. So that is something on where the sector is playing a key role in food security, and they have a link with the cash working groups that has been announced, that was spoken of earlier. This cash working group integrates the social protection part, which is reactive to shocks, and it is a social protection program which is multi-sectorial and is adapted to shocks, but also it has an intervention aspect which, regarding the humanitarian aspect, it should be well coordinated. We clearly see here another spectrum where we can see a number of actors that are coordinated here and which are in charge with, which are working in line or hand in hand with the Ministry of Social Protection. And they are supported by the World Food Program, the World Bank, UNICEF, such that when there is a disaster, they can implement a response strategy. This is a diagram you can see here. The social protection program is represented by this red line, this red dotted line, as you can see here. At a particular point, our plan should be coordinated and should be adapted. That is why we have a point here called B for the response. But B1 is a response to the shock. Thank you very much. Thank you very much. I would like to apologize that we had a delay due to certain technical difficulties with the sound at the beginning. Thank you, Madagascar team, for having explained to us how they achieved this provision of this packet, which is harmonized between the different funding sources in terms of the amount transferred and in terms of geographical coverage in the villages, and also regarding to the efficiency or how the manual which guides the entire operations. So we have the social protection guide or on reacting to shocks. It is very clear and is well explained. It explains the different plans, how they can adjust the amount transferred. Right now, I shall give the floor to Niger, and I would like to apologize for the delay. Good morning, dear colleagues, dear partners, fellow participants. Thank you for giving me the opportunity to share with you in this webinar on the experiences in terms of the national response plan to improve the role of the national response plans in improving the coherence and coordination of humanitarian assistance and social protection. I will be assisted by my colleague. So I will talk about the context and the profile of humanitarian assistance in Niger. So we're going to talk about the contribution of existing tools . We're going to talk of the role of national response plans in improving linkages between humanitarian and development interventions. So as you can see, the complex is very different from that from Madagascar. We have several nutritional crises, severe acute malnutrition, and since 2007, we are facing a food crisis, which is affecting a good number of people, about 2,000, more than 2,000 people. In 2022, we see that 4.4 million people were affected. And this data was collected during the study carried out in March, from March to April 2022. We can have an overview here in this image of the humanitarian needs and the state of response. We see that there are over 400,000 children who are at risk of severe malnutrition. And also we see that there are about 4.4 million people who are at risk of food crisis. Also, in the year 2022, we were expected to help 497,200 children. Niger is also a country which is severely affected by other diseases. There are about 400,000 youths which are affected in the western part of the country. It affects the region of Difa. There is insecurity in that region. In the northern part of Niger, we equally have insecurity crisis. So in terms of the internally displaced population, which is affected, we have 151,000 people who are affected. That is 51% of internally displaced persons. Niger is equally affected in terms of consequences of conflict-related crises. We see here that this crisis seriously affects children, especially children. We have many schools which are closed. There are so many children who are not in school because of conflict-related crises. Niger is also a country which is affected by disaster. Each year, we have about 200,000 and 250,000 people who are displaced because of these natural disasters. And right now, we have about 600,000 people who are affected by natural disasters such as flood. Also, in terms of epidemic, we have the COVID-19, cholera, meningitis, and measles. Just to name a few, these are the epidemics that are affecting the country. Regarding this very difficult context faced by Madagascar, Niger, we have also formulated a national response strategy . We have difficulty moving to the next slide. Is it possible for us to have the next slide, please? Okay, I think it is good now. Just like Madagascar, I said that Niger has also implemented a national response strategy which coordinates with all the actors be they government actors, be they humanitarian actors, in order to solve these multiple crises. So I will give an example regarding the insecurity crisis. We have 4.4 million people who are affected, and in the response, 4.1 million people have been targeted. That is 1.4 million people from the government, 2.2 million people from the World Food Program, and 500,000 people from non-governmental organizations and ICRC. So the total coverage, the total percentage coverage is 95%. Regarding the malnutrition crisis, we have 497,200 children who are our target who are our planned target, and the total percentage we have now is 46%. From our past experiences, we have never ever have only 100%. We have had more than 100% of effectiveness in our implementation. Currently, we have 300,453,000. We have 300,453 children who have been affected and who are involved in the response strategy, giving a total percentage of 52. For the next type of crisis, which is the displacement of population, we have 563,000 people who have been displaced, and those who need assistance are 681,071 people who have been displaced. And we have, for flooding, we have 26,724 households, or 225,539 people affected for flooding. Just to give you an idea of the financial mobilization, I have divided it by forecasted million contributions received, the mobilization rate, the state of contribution,
we can see that the is around 236,000 euro, which is a mobilization level is around 70 to 80%, with disaggregation of 30%, which is from the which represent the contribution of the state, and 70% is the partners, humanitarian and development partners contribution, which are supporting this assistance plan. And we see that for 2022, the niche the needs of HRP is around $552 billion. So thank you. Science. So a last slide. Rapidly, I will just talk about the institutional framework. And concerning the institutional framework, institutional setup, which is set at the level of the Prime Minister's office, which is in charge of the response of seasonal and current and chronic food, pastoral and nutritional insecurity. And this system today has 14 technical and financial partners which are supporting this system, and which are organizing meetings with other partners which has not yet signed a financial and technical agreement. That is, we are talking of several partners, NGOs, international NGOs representatives. Just to tell you that the system brings together all the stakeholders that are fighting to against this thing. And in terms of organs that are supporting, we have a early analysis system which are analyzing the needs in terms of security needs through harmonized framework. And there are also crisis cells which are in charge of response. They are the social net unit which is in charge of multi-year cash transfer to very poor and chronically vulnerable households. And we also have the permanent secretariat which are in charge of coordinating and of the strategic dialogue and the mobilization of fundings. Beside this system, we have the Ministry of Humanitarian Action and Disaster Management, which are in charge of forced displacement of population, flooding, and other disasters. We have the Ministry of Labor and Social Security, which is in charge of the the social protection national policy. So each of these entity in its competency, which makes sure that there are national reference strategies existing, there are joint planning and monitoring tools, and that there are also consultation and coordination mechanism, including all the technical and financial partners. I will stop here and I will give the floor to my colleague Madu to continue with the presentation. Thank you. Good morning to all. Can you all getting me? So from what Madu already shared and explained, he gave the humanitarian profile that we have here in Niger, the institutional landscape that we have, and we are precisely going to see how the tools that exist help to integrate the efforts and the social protection assistance that we have put in place. I will try to show the slides. So we are going to talk of the tools, the existing tools, existing in terms of shocks and in the domain of social protection. And we are also going to talk about the protection mechanism, and we are going to do a little synthesis of the challenges we face in Niger. I'm still waiting for my slides to appear. It seems I have a problem sharing the slides. So rapidly, I will just go through them quickly because we are late on our schedule. On the left side of the slide, you have the list of tools and strategic frameworks to respond to emergency. As Sidril and Amadou mentioned, Niger is faced drought and flooding, which pushed the country to some crisis, and there is a strategy for food, pastoral, and nutritional insecurity, and it depends on the Prime Minister's office. And each year it sets a support plan for vulnerable population, and it plays the same role as that of Colonel Fali, which is to give an idea of the needs and how the various actors could intervene. In terms of tools of in vulnerability analysis for flooding or droughts, we have tools which have been suggested in the framework of sub-regional organization which are focusing on harmonized framework. And we have the harmonized framework, which is a direct subsection of the IPC, which help us to draft maps and to identify needs in terms of famine. And we also have these plans that respond to the needs of the various partners. We also have a humanitarian response plan, which is a more larger plan, but it also involves other shocks. We can come back to it. There are also a certain number of technical standards and common standards to actors which are fighting against natural shocks, like Madagascar already mentioned it. We also have amounts for food aid which are already harmonized, which went from 32,000 CFA francs per month to 42,000. We also have standards for food response and pastoral response. We also have all the tools to share and coordination, which are matrices. We may come to it. We may come to the various role of these various clusters concerning the social nets, and which aims at addressing extreme poverty and vulnerability. We have tools. Amadou talked about the Ministry of Social Protection and also the role of the social net units. We have a social net project which has already affected 400,000 households, or between 2 years, from 10,000 per month. They have received an allocation of 15,000 per month. The analysis of vulnerability is mostly based on poverty and ECMV data, and we use the proximity test method, which take household surveys to identify the poor households. In terms of practice, this project exists for 10 years now, but it has been applied by a certain number of stakeholders. This social net project is under the social net units, and we also have a tool which may be really useful in terms of the social protection, which is the social net integrated in the support plan. It is a practical tools which may be useful in the field to coordinate our actions. If we focus on the support to populations, it covers all the food, pastoral, and needs on a year, be it a result of but there could also be food needs that have been addressed by populations. And for years now, this support plan integrates the pluriannual support, social net support, but it remains at a global and programmatic level. So we have difficulties getting the speaker. Those are elements on which we rely to ensure dialogue between the various partners. And we also have a very good coordination and dialogue, a high level and strategic dialogue between the PTF and an interministerial committee. And we also have consultation framework, which is the result of a long partnership between 14 PTF that have been set up. At the technical level, we rely on clusters, the social security cluster, the food cluster, as Madagascar mentioned. And recently, we have a working group called RAM, which is a quick response mechanism, which has been set up to assist IDPs. At the lower level, we have a problem here in Niger because there are a large number of stakeholders at the central level, but at the local level, we still have issues because the local and regional authorities are yet to be installed, which is at time the excuse they use to justify the absence of stakeholders at that level. So, but at time we have technical actors which are working at the sectoral issues as far as instruments of the social security. We have interministerial committee which are working with the cash working group. In this cash working group, we have actors working in the monetary transfer. And in this transfer group with social security, we focus on stakeholders which are working on pluriannual. And we also have others coordination framework on social security, which does not only have not only the social nets for vulnerable households, but we also have the contribution of the social security, which unfortunately it's managed by a unique committee, and at times we have different points of view, not only concerning the social net and the vulnerability. But so to conclude, if we want to summarize the assets and the difficulties we face to better articulate a response and efforts and sustainable efforts towards reducing vulnerabilities as an asset, we could insist on the experience gained by the government and the units in charge of seasonal response. We talk of food crisis when it is a bad campaign, but we are also facing. We also have agricultural campaigns where each year, in some areas of the countries, the government will do some contribution or low cost sellings, and all these means are well arranged with the partners, and we have a lot of references and consultation framework
to harmonize this practice. And we also have a diversification of approach, which is given to resilience and to response, but also to structuring investment in agricultural development, which is trying to be complementary to the response given. And it is true that the development strategy, which has been implemented since for 10 years now, facilitates the integration of the taking care of food security and more sustainable approaches in social protection. We also have a set of constraints which complicates the systemic effects on the recurrent responses that we have in terms of social protection. On one hand, during the last years, we were affected by several crises in Niger. So in particular, the population were forced to internally displace themselves due to the food crisis. And this had led to a new type of sectorial need, which was urgent. That is why this was created some years ago. It does not yet have the capacities or the tools for coordination. So they didn't need to structure the responses in function of the needs of the population and in function of social protection. Structurally, we also have challenges of developing a vision for leadership on the part of the government in terms of social protection. So there are efforts which are ongoing, for example, universal health insurance, or some pillars of social protection. But the measures to be taken should be systemic to enable households, or maybe the 5% of the population that need a support in the long term to come out of poverty has not yet has not yet been given. We don't yet have strategic tools. And at the level of the technical aspect, we have an obstacle to face. We have so many constraints. We don't have the same way to analyze the vulnerability of the environment. It is not the same reference data. There are eligibility criteria which are used. We're trying to link or create a method, a system of synergy to help us be more efficient. We have a program which is funded by the World Bank, which is henceforth a social protection program adapted to Madagascar, and Madagascar was talking to being adaptive to shocks in order to extend to the horizontal and vertical side. But these efforts are not yet linked to each other in terms of managing food crisis in these countries. Some interesting assets are operational. I'm going to end here so that we can have a few moments of exchange with discussions. Thank you very much for this condensed information, synthetic information. It's a brilliant work that you have done in Niger. Thank you very much. This shows effectively how you have sequenced your plans and the different parts have been integrated or are trying to be integrated, and to give us an overall view of the number of the population that is covered or not covered. It is wonderful, but now we do not have much time left, but I shall seize this opportunity to ask a question to Madagascar and then to Niger while waiting, because we don't have much time left. I'm going to invite all the panelists, all the presenters to go to the question and answer box, because there are questions from Madagascar which are pending. We can start answering. You can either type your answer. So regarding to Madagascar, what has been asked is the role of the cash working group as a main tool, or the key aspect, the key tool that makes the governance or the government or the different actors to operate properly. For example, the funding from the bank, the World Bank, that passes through the national mechanism, or even from humanitarian that does not go through the government, but which is implemented parallelly. But there's also this consultation on the minimum package. And also, what is amazing is that we are trying to have a scaling up of the responses from the government. So this scalability that we have succeeded in having in the last year, with clear deadlines, it is not yet perfect, but that is the question for Madagascar. Could you tell us and try to divide the powers of the actors, what they do? Have you succeeded in dividing the different actors? Even if you mention it implicitly, who are the actors who are in charge of food distribution or money distribution? Can you explain this point, how it works in terms of governance? And for Niger, in terms of governance, once again, we would like you to explain what you think and why we are not able to have this integrated package from the small actors. What do you think, and how can we go forward to assemble all the actors which are working in this in line of this objective? What is their interest? What is their motivation? How could we motivate the actors to help them align with themselves? Thank you, Madagascar. You have the floor. You can explain to us in terms of governance how you got to this level of assembly. Thank you very much. Maybe Colonel Fali will answer the question, or the Minister of Social Protection, if you like. Mr. Director, would you like to take the floor? Okay, I'll take the floor. Allow me, can you allow me not to turn on my video, not to allow my connection to run smoothly? I hope you guys can hear me clearly. Yes, we can hear you clearly, but you have 2 minutes. Please pardon me because we have to give the floor to the participants and we have just 7 minutes left. Regarding the coordination, at the level of the Madagascar government and social protection, there is this thematic of social protection which has been implemented since 2017, and it is divided at the national level as well as the regional levels. It is applied to the ministries which are involved, for the Ministry of Education, Ministry of Health, Ministry of the Environment, Ministry of Water, Ministry of Agriculture, Ministry of Labor, etc. There's also this coordination structure which has been implemented at the level of the PRGC, which regroups the management committee, and it also regroups the different ministerial actors which are involved at the national and international level. They intervene urgently at the level of the PRGC in relating to the ministry in charge of social protection. We handle protection at the level of BGRC, and anything that deals with food and livelihood, they handle that for now. That is what I could say, and Colonel Fali would add anything if he has to add anything regarding this issue on coordination. So for Niger, what we can say is there are harmonization efforts which are being deployed in the short term, and a sum has been established, about 35,500 CFA francs. Recently, we were trying to increase this amount to support or to cause an impact in the lives of the people, etc. There are also other factors. We are trying to increase this amount to 40,000 francs CFA. So there are so many efforts that have been made in harmonizing this plan, this strategy. Thank you very much. We are also faced with the problem of dialogue and articulation between the actors and the environmental response. This national response strategy has a crucial role to play, but we realize that to develop important tools which shall be operational, there is a long way to go. Maybe we have tools which are per intervention areas and a percentage of households which are covered in the social plan. We have seasonal responses, and we hope that they shall take into consideration what is already existing and to clearly share the information. This is an objective that we should aim at. Also, the cherry on top would be to harmonize the social protection actors, but it's also an issue on the possibility of using one tool which is not regularly updated. If we could decentralize the household databases, we can have the status of those who are vulnerable and have specific information on those who are in need. This is a very important tool for humanitarian actors. The base has been, the foundation has been laid, the will is there, but there's a targeted work that has to be done. for some weeks now, a new assistance from the United Nations has been given, and it is integrated. That is what we are worried about. Thank you very much. Thank you very much. While waiting, I would like to know if the Ministry of the Population and Social Protection, could you answer in the dialogue box the question from Sirad? I suggest that you answer the question, you type in the answer, the question on the sustainability of transfers, which is an issue that goes beyond this debate. Also, there is another question from Rimno. Thank you, Rim. He's asking the two countries to know. Someone is typing in the response, but is asking to find out at what point in the process can social protection actors intervene in national disaster or shock or food insecurity management planning to include a targeted response for vulnerable households through social protection programs and social safety nets. Now I will give the floor to Madagascar before giving the floor to Niger. Thank you. Yes, for Madagascar, we can say that there is a plan that is done annually, which is elaborated annually regarding the drought crisis as well as the flooding crisis. To add, I could say my colleague will add, in general, we should not wait for a crisis before we act. We should coordinate our actions and take into consideration the response strategy in the national response plan. In Madagascar, not only there is a plan that has been announced, but also there is also all the preparations that we are doing. You have already spoken about a plan that we are currently implementing to define the minimum package. What is the amount for mobilization? Who is doing what, when, and where? So we have also worked with the Ministry of Population. We have a convention with the Ministry or Development. To summarize, we need to start working from now and link this process with the response to shocks, and we need to talk with those who are in charge of risk and disaster management in order to coordinate our actions. And when there will be a disaster, we will better coordinate our actions. Mr. Colonel, do you have a word to say regarding the funding? There was also a question on that. It's true that it has been answered, but could you give us your opinion on the funding linked to the routine transfer systems? Should they be scaled up, or are these fundings received later? Are they in agreement with the Ministry of Finance, or can you just give us your thoughts on that? I think for the social protection program, regarding our method of work, Madagascar has a national capacity, and this national capacity is, if it does not supersede a level, normally the partners and the government should have a capacity to intervene rapidly for these households and for these populations. But when we evaluate with ITC and evaluate all what has been done, there's a number of evaluations that enable us to have the results. what are the populations and the households that are in need. From there, we can identify the gap to be filled, and from this gap, we shall now determine how to mobilize resources. There are resources available, but we also have challenges in mobilizing the resources. Thank you very much. Can Niger add something before we round up? Regarding the case of social protection, regarding the social safety net, in Niger, it is almost similar with Niger. We have monetary transfer policies. We have social protection programs which are funded by UNICEF, the World Bank, and the World Food Program for now. The support from other partners should be given so as we can further our development and help households which are particularly in need. Yes, that is it. Thank you very much. Thank you, Niche. Do you want to add something to that? We can say that it is not actually what is expected from social protection, but it's something from where we can work on, we can see what has been done. It should be easier to map out or to capitalize what has been done and take into consideration the work that is already existing in a structural way. We just have to present it to those who are concerned. It is important for the environmental actors to have this information, but also these mechanisms to respond to shocks should be more systemic with guidelines on horizontal and vertical extension, etc. We have asked the actors of social protection to integrate this dynamic and also the stakeholders to carry out efforts which are sustainable. But I think that in Niger, as you have said, we are focused more on the environmental results, and we want the program to be well funded. It is mainly on the social protection aspect that we have efforts, we have to deploy our efforts. Thank you very much. There are two things that you have said. You have spoken of social safety nets. We need to scale them up, and we need to identify the areas where they intervene and identify the needs, be they horizontal or vertical. So the Niger solution is that the humanitarian actors should complete what has been done, and they should work in the routine. They are not going anywhere. That is a very interesting dialogue. Now we're going to close. One last time, I will give you the floor. Maybe we shall begin with Niger. Do you have something else to say that the participants can take home and what they can retain as good practices in order to succeed or to have a successful integration of this package? Thank you. I think that as a lesson learned, we have all noticed the importance of having the leadership and that is the role that is played by the national mechanism. So it's also the role that it plays as such. It is important for us to have a good continuation of the dynamic in terms of coordination and consultation between the state and the humanitarian actors of social protection.
Joint approach, it is important to keep in mind that so we can get the speaker, especially food shocks related to a forced displacement of populations, and also to find response to flooding between others. So it is also important, as you could notice, that some tools have been set up to better articulate an efficient and effective articulation of our actions on the field in terms of technical references for the intervention of the social traceability of beneficiaries. And there is also an importance is given also to to ensure that uh, in a short and long term there is articulation between some innovations in terms of response, and we are talking here of RMM mechanisms, quick response mechanisms, which are necessary to integrate it, which should be integrated in long and short term response mechanisms. And in Niger, we are um, forecasting already on these various aspects, and talking of the nexus on sustainable solutions. So these are some points that Niger wants to bring forth in terms of key messages or takeaway. Thank you very much. Thank you very much. I'm sorry. So we still have 9 minutes. So as a last ingredient, so what could you say? What are the 2-3 key elements that we need? So in terms of perspective for Madagascar, Madagascar aims at updating its social protection national strategy, which will be scheduled for 2024 and 2028. And also, Madagascar has some beneficiaries in order to build this social security program for beneficiaries. In terms of humanitarian action, we also ask for your support to sustain the actions of Madagascar, and in terms of coordination too, the ministry and being stay with our convention, we are trying to sustain this convention in order to have a social protection which adapts to shocks and is efficient for the case of Madagascar. Thank you very much. Please, if I can take 30 seconds. I think that it is very important that the government should appropriate the concept of social protection. And as we are discussing here in Madagascar, we should order to put in place measures to respond to shock, and based on the nexus, humanitarian stakeholders are not working in on their own. Social protection actors are not working on their own. So, and we need to work together, and normally there are also available capacities available to development stakeholders. Those are resources that are available locally, and if we can work together and anticipate, as we are already doing here in Madagascar, have a platform to discuss is really important. Thank you very much. We are going to conclude with these words for everybody. Okay, we just want to thank the participant. We are left so we want to thank our various speakers for their presentation, their brief presentation. So we cannot get the speaker. Okay. Goodbye, and thank you for joining this session.